I'm one of the general surgeons who works for Krause Medical Practice. I'm one of the general surgeons who also has incorporated robotics as part of my practice. I realized more and more of my patients would benefit from the technology for many reasons. One is less pain. Generally, these operations are less painful. Two, it allows us to do very complex operations that we may not be able to do in a traditional, minimally invasive way, in a way that is minimally invasive. And three, when it comes to time in the OR, robotics actually can decrease patients' time in the OR and our time in the OR, so we're not only getting patients in and out faster, but we're able to get more cases in during our operative day. Some of the added benefits of this system are, one, tactile feedback. One of the biggest knocks against robotics was you had no tactile feedback like you did with contemporary laparoscopy. And that was a big deal for surgeons because that's how you knew you were handling tissues safely, and that's how you were doing your dissections, and you had to learn a whole different sort of visual cue system with the robot. We're considered one of the top tier programs in the Northeast. We have over 6 service lines that use the robot and over 40 surgeons. So from an experience perspective, I don't think there are many places within the Northeast, never mind Central New York, that have this kind of experience. And one of the reasons is we have very good people in place at both the administrative and clinical level who have made this happen. And we've been able to share with them the benefit that robotics brings to our patients. They in turn have gone out and made it easily accessible for us. From the tech staff, to the PA staff, to the people who clean the instruments down in sterile processing, if one of these things isn't working, the whole system falls apart. So teamwork isn't just something that we talk about as a matter of course, it's essential for the program to run efficiently and in a way that's safe and productive. We do the highest volume of robotic cases every year in the region. We bring in other surgeons to watch us do cases. Some of us go and proctor other surgeons on the robotic system. So our reach and our breadth doesn't just touch the patients here, it touches other programs within the region and even outside of our region, because we're passing along all of the knowledge we're getting from our experience to other surgeons and programs. We're here to serve the community in a way that's safe and in a way that gives them the best technology when it comes to their operations, and in a way that makes them comfortable when we're here. And I know we've talked about the team approach, but that team approach also includes the people who take care of our patients in the postoperative setting, both in the outpatient surgery center and here. That's a huge component of why people enjoy being at Krause, is their experience is markedly different from other hospitals in the region, because there's such attention to detail at both the operative level with the robotic systems we have and at the patient care level once their surgeries are over. In my mind, the philosophy should be service oriented. It should be getting people the safest operations they can get with the best technology that's available. And from a postoperative perspective, keeping them as comfortable as they can be and making sure the whole experience, not just the operation, is a great experience. I can't think of any surgical maladies that the robot can't take care of, and the best surgeons in this area work at Krause when it comes to robotics. Many times people come back to my office, and although they don't remember their surgery because of the anesthesia, they remember how they were treated before and after surgery. And I can tell you, many of these patients are very complimentary when it comes to the care they receive both before and after the operations.